a scan of the room. I'll start. First, I'll wash my hands, don my gloves. Wipe my stethoscope. Introduce myself. Good morning, my name is Sarah. I'm a student nurse from Seneca, and I'm here this morning to do your general head to toe assessment. Please do you mind stating your name and your date of birth, and I'll be confirming it with your ID. Patient stated name and date of birth to be same with the ID. So before we continue, do you want to use the washroom? You're okay? Are you comfortable where you're seated? Okay, so I'll provide privacy for the patient. Then I'll go right away and start. First, we're starting with the general assessment. And for the general assessment, the patient and the physical appearance, patient's age appears to be adult age with what the patient has stated. And the skin, the color of the skin seems to be same with the generic background of the patient, and there's no any odor. So for the behavioral structure, of the patient is seated at an upright position. The nutritional nutrients of the patient, the fat is evenly distributed with the body, and the posture of the patient is upright. I don't see any deformities, physical deformities of the patient at the moment. Then for the behavior, the patient is the patient is having a good eye contact with me, the examiner. The mood of the patient is friendly. The patient is well dressed for the weather, and the personal hygiene of the patient is clean. Then for the mobility, please could you just walk to the door and walk back. When patient walks to the door and walk back, the gait is smooth and balanced. And for the range of motion, it was accurate, even, and smooth. Then for the work of breathing, is smooth and is balanced. Then for the level of consciousness, please can you state your name again? What time today? What time is it now? And then where are you? Patient has answered the 3 questions. Shows that the patient is alert and the patient is awake. So we'll be moving to the head inspection of the skull and the scalp. So I'll start by inspecting and palpating the skull and the scalp. So for the skull of the head and the scalp, the head is even. There's no any lumps. There's no swollen around the head, and the hygiene of the head is clean. I don't see any. I don't feel any tenderness of the head, and there's no any deformities around the head. Then I'll be inspecting and palpating the hair. So for the hair, is evenly distributed, and there's no any infestation in the hair. Then I'll be moving to the inspecting the physical structure of the patient. So for the physical structure of the patient, I'll be inspecting and palpating it. Can you sit up, please? Do you feel any pain? There's no pain. There's no tenderness. The temperature is warm. The body temperature of the patient is warm. There's no any scar. There's no lesion. The face is symmetrical. I do not see any swollen around the face. Thank you. Then I'll be testing for the criminal nerve 7, which is the facial. And for these nerves, please, you just do as I do. Can you smile? Can you show me your teeth? Can you shut your eyes? Can you frown? Okay, thank you. So patient has done all this, so they are all symmetrical and they are intact. So CN7 is intact. Then we'll be moving to the eyes, and for the eyes, I'm going to be inspecting the eyelid, the eyelashes, and the eyebrows. So for the eyelashes is evenly distributed on both eyes, and for the eyes are round. I don't see any discharge around the eyes, and there's no crusting around the eyes, and there's no lag around the eyes. Then I'm going to be testing for the CN3, which is the olokomotor. Then I'll start with the pupil size. So for the pupil side to this side, I'm seeing 4 mm. To this side is 4 mm. Then for the symmetrical, both eyes are equal. Then for the shape of the eyes, they are both round. And for the light direct and the conversion light reflex, I'm going to put my lights here and bring it to this side and from this side. So when I do the light reflex, the direct and the constitutional light reflex, they both eyes both they were both constricted. Then for the accommodation of the eyes, please can you just look at the tip of my pen? I'm going to be bringing it closer. Thank you. So when I do the accommodation, the eyes are both dilated at this time, and then the both eyes, when the pen was getting close, they both converge together. So we'll be moving down to the ears, and for the ears, I'm going to be inspecting your ears. There's no any discharge in the ears, and the ears are both symmetrical. There's no any swollen. Then I'll be palpating the tragus, the auricles and the tragus of the ears. So for the auricles, do you feel any pain? No. Tragus pain? No. So they are both intact. There is no pain. Then I'm going to be doing the 3 whisper test. Please repeat what I say in each side of your ears. So for the 3 whisper tests, the patient has repeated them nicely. The first one I said Monday, Tuesday, Wednesday. Here I said rice, beans, and yam. And the patient has repeated them to me. That's good. So we'll now be moving to the nose. And for the nose, I'm going to be inspecting the nose. And the nose is in the midline position. I do not see any discharge on the nose at this moment. Then I'll be palpating the frontal and the maxillary synapses of the nose. So for the frontal, do you feel any pain? There's no pain, there's no tenderness. And the maxillary, there's no pain and there's equally no tenderness. So it shows that the nose is intact. So we'll now be moving down to the mouth. And for the mouth, I'm going to start with the lips. So for the lips, there are no swollen, there's no lesion, and there's no any dehydration. Can you open your gum for me? So the gums are open. I do not see swollen, there are no lesion, and there's no hydration. And the teeth are not loose anywhere. The teeth are intact and they are well positioned in the mouth. Let me see your tongue. Can you raise the basement of your tongue? So when the patient raises the basement of his tongue, there's no lesion and the tongue is both symmetrical and there's no any dehydration or swollen too in the tongue. So for the hard and the soft palate, can you just open your mouth again? So for the hard and the soft palate, there are no lesions and the hard and the soft palate is intact. So now we'll be moving to the test of the CN9, which is the hypoglycol, and the CN10, which is the vagus. So for the hypoglycol and the vagus criminal nerves, please can you just open your mouth and say ha for me? So when the patient said ha, the uvula and the soft upper palate went up, indicating that there is no any they are both intact, sorry. So I'll now be testing for criminal nerves 12, and the criminal nerves 12 is the hypoglycol, yes. So for the hypoglycol, please can you open your mouth again? The tongue is in the midline position. Can you move your tongue to the left and to the right? So can you say light, tight, dynamite? When patient says light, tight, dynamite, there are no tremors in the CN12. So CN12 is equally intact. Then now I'll be moving to the neck, and for the neck, I'm going to be inspecting the neck and palpating the neck. So for the inspection of the neck, do you feel any pain? There's no tenderness. The temperature of the neck is warm. Then it's symmetrical. There's no any scar, and there's not any thyroid deformities around the neck, and the hair distribution is even on the neck. So now I'm now going to be palpating for the carotid arteries. So for the carotid arteries, I'm going to be palpating at this side of the neck for a minute. For 1 minute, the rate is 14 beats per minute and the rhythm is regular and the strength is +2, and I'll do the same here, the same thing. So thank you. Then I'll now be testing for cranial nerves 11, which is the spinal accessory. And for the spinal accessory, I'm going to put my hand on your neck. Please, can you just try to turn your back and your neck to this side to add a little resistance? Any pain? Same thing here, no pain. And I'm going to put my hand here. Can you just try to resist with your shoulder up? No. Do you feel any pain? So cranial nerves 11 is equally intact. So we'll now be moving to the upper extremities. And for the upper extremities, I'm going to start by inspecting the hand. Can you just please raise your shirt up? I'm going to be inspecting and palpating the shoulders, the upper arms, and there is no any tenderness. No, I will inspect it first. There is no any scar, there's no lesion, and there's no any deformities. I can see the hair are evenly distributed. Then I'm going to be palpating it. Do you feel any pain? No pain. Then the temperature is equally warm. There are no masses, and there are no deformities. There's no swollen also in the upper extremities. So now I'm going to be checking your nails. Okay, and the capillary refill are even and nice, and the color of the nails are pink. Thank you so much. Then I'll now be checking for the test and the active test of motion. So for the active test of motion, please can you stand for me and face the camera? So for the active test of motion, I'm going to ask you to flex your fingers, extend it, flex your wrist, extend your wrist. Can you radial deviation of your wrist, ulnar deviation? Then can you shrink your shoulder? Can you extend your elbow, flex your elbow? Can you elbow in a supine position, in a pronation position? Can you shrink your shoulders? Okay, can you adopt your shoulders? Adopt it. Can you rotate your shoulder? Inward rotation, outward extension rotation. Thank you so much. Did you feel any pain? Okay, please, you can sit down. So I'm going to be palpating for the radial pulse on the wrist of the hand for 1 minute, and the rhythm is regular, and the grade strength is +2. Thank you so much. Then I'm going to be testing for the strength of the hand. I'm going to hold your hand. Can you just apply a little resistance? Did you feel any pain? So for the test of the hand, the strength is strong. So now we're going to be moving to the lower extremities. So for the lower extremities, could you just fold up your shoulders, your pants up? Thank you. So I'm going to inspect the lower extremities first. Then in the inspection, I don't see any scar, there's no lesion, there are no swollen anywhere, the hair are evenly distributed. Then I'll be palpating the lower extremities. Do you feel any pain? No pain. Okay, the temperature is equally warm. I don't feel any masses, and there are no deformities also. So thank you so much. So we'll now be, can you just lie down? Thank you. So I'm now going to be palpating for the dorsal pedis. So for the dorsal pedis is on top of the feet, and I'm going to do it for 1 minute. So for the dorsal pedis is the rhythm is regular and the strength is +2. The rate is 14 beats per minute. Then for the posterior pulse is at the, behind the ankle of the leg. So I'm going to be testing it for, I'm going to be palpating it for 1 minute also, and it's equally 14 beats per minute, and the rhythm is regular, and the strength is +2. Then I'm going to be we're going to go to the dorsalar flexation. So for the dorsalar flexation is when the patient is lying down like this straight on their back, and you ask them to push their leg backwards, and you apply a little resistance if there's any pain, And the plantar fixation is when the patient is still lying down flat and you ask him to try to extend his foot forward and you try to put your hand to resist it. So this is the dorsilar fixation. Do you feel any pain? So for the plantar fixation, I'm going to try to extend your feet forward and push it down. Do you feel any pain? No pain? Okay, so I'm going to be sanitizing my hands again. Thank you so much. Then we are going to be moving to the posterior thorax. And for the posterior thorax, I'm going to start with the back. So please, you'll be turning your back for me and raising your shirts. Thank you. Then I'm going to be inspecting the posterior thorax. So for the inspection of the posterior thorax, I don't see any scar. There is no any deformities. There's no any skeletal deformities here. The back is symmetrical and there's no lesion at the back. So I'm going to be palpating it now. Let me know if you feel any pain. No pain. The temperature is equally warm and there are no masses and there are no swollens around. There are no lesions. So now I'm going to ask you to just take a deep breath in and out. So when patient took a deep breath in and out, I did not hear any sound. So I'm going to be palpating the posterior thorax now. So I'll tell you to take a deep breath in and out in each spot. Breath in, out, 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 in, out. Thank you. So when the patient was taking the deep breath in and out, I did not hear any crackling or whistling sound on the posterior thorax. So this is an indication that the lungs are clear. Thank you so much. Turn and put on your shirt back. So now I'm going to be inspecting the anterior transverse here, which is 2, and the posterior is 1. So the ratio is 1 to 2. Then I'll now be assessing for the anterior thorax. So for the anterior thorax, I'm going to assess it for a minute, and I can see that the strength is the rhythm is regular, and the respiration is smooth, and the rate is 14 beats per minute. So thank you so much. Then we're now going to be moving to auscultate the valves, and for the valves there are 4 spots that I'm going to be auscultating here, and for that's the cardiovascular valves. So the first one is a second intercostal valve, which is called the aortic valve, and then the second one is the left second intercostal valve, which is called the pulmonary valve. So this is the second aortic valve, the intercostal valve. This is the second left intercostal valve, which is a pulmonary valve. Then the fourth one is called the lower intercostal valve, which is the fourth. It's called the transcuspid valve, and it's here. Then the fifth one is below the breast, and it's called the mitral valve. It's the fifth valve. Okay, so all the sounds are audible and clear. Then for the S1 and S2, the S1 is at the apex between the transcuspid valve and the mitral valve, and the S2 is at the base of the aortic and the pulmonary valve up here. So it's just here. So the sound, I'll auscultate it too for 1 minute, and for this one it's around here. Thank you so much. So during the auscultation, the rhythm is regular and the heart sound is clear and audible. Thank you so much. So we're now going to be moving to your abdomen. So we're going to raise your shirt a little bit up for the abdomen. Then I'm going to cover you here. Then I'll be inspecting your abdomen. The abdomen is in a midline position. There's no any scars. There's no lesion. I don't see any swollen. The hair is evenly distributed. Then I'm going to be auscultating the 4 quadrants. So I'll start anti-clockwise. I'll start from the lower left quadrant to the upper left quadrant. So this is the lower left quadrant. I will be oscillating it. This is the upper left quadrant. This is the upper right quadrant. This is the lower right quadrant. And the sounds, I didn't hear any sound of the bowel at this moment. So I'm going to do a light palpation. Let me know if you feel any pain, please. So for the palpation, do you feel any pain? So there's no tenderness. The temperature is warm. The hair is evenly distributed. And there are no lesions here. Then I'm now going to be palpating the bladder. And the bladder is not full. So this ends my assessment.